This is a review of the two-handed backhand for tennis, and this is a full-body movement involving three different phases: the preparation phase, the contact phase, and the follow-through phase. Starting from the ground up in a joint-by-joint approach, it involves the ankle, knee, hip, pelvis, lumbar spine, thoracic spine, shoulder joint, elbow, and wrist. Each phase will emphasize the right side joints as this is a right-handed player. Starting from the ground up, we see that the subtalar joint steps into E version. The talocrural joint goes into dorsiflexion. The tibiofemoral joint is in a flex position with the acetabulofemoral joint in slight flexion and external rotation, and the lumbar spine slightly rotating to the left with left lateral flexion and slight flexion. We see the thoracic spine slightly rotating to the left with left lateral flexion and slight flexion. Then we can see the scapulothoracic joint coming into protraction, the glenohumeral joint coming into internal rotation and adduction, with the humeral ulnar joint in an extended position, the radiocarpal joint in a neutral or slightly extended position, and the radio-ulnar joint in a neutral and slightly pronated position. During the backswing, the eccentric contractions of the gastrocnemius, soleus, quadriceps, gluteals, and hip rotators load the legs and begin the hip rotation. Concentric contractions of the ipsilateral internal oblique and the contralateral external oblique are aided by eccentric contractions of the contralateral internal oblique, ipsilateral external oblique, abdominals, and erector spinae. The shoulder and upper arm on the dominant side rotate through the transverse plane through concentric contractions of the anterior deltoid, pectoralis major, subscapularis, and wrist extensors, and eccentric contractions of the posterior deltoid, infraspinatus, teres minor, trapezius, rhomboids, and serratus anterior. On the non-dominant side, concentric contractions of the middle and posterior deltoid, latissimus dorsi, infraspinatus, teres minor, and wrist extensors create the rotation of the shoulder and upper arm, assisted by eccentric contractions of the anterior deltoid, pectoralis major, and subscapularis. In the contact phase, the subtalar joint goes from eversion to neutral. The talocrural joint goes from dorsiflexion to neutral. The tibiofemoral joint remains in a flex position. The acetabulofemoral joint remains slightly extended and transitions to internal rotation. The lumbar spine changes directions and goes into right rotation with slight lateral right flexion. The thoracic spine follows suit with the lumbar spine rotating to the right into right lateral flexion, while the scapulothoracic joint goes into a retracted position, and the glenohumeral joint slightly externally rotates and slightly abducts. The humeral ulnar joint, radiocarpal joint, and radio-ulnar joint remain unchanged from the prior positions. During the forward swing to the contact phase, concentric and eccentric contractions of the gastrocnemius, soleus, quadriceps, gluteals, and hip rotators drive the lower body and hip rotation. Concentric and eccentric contractions of the obliques, back extensors, and erector spinae rotate the trunk, while the upper arm on the dominant side moves the ball through concentric contractions of the infraspinatus, teres minor, posterior deltoid, and trapezius. On the non-dominant side, concentric contractions of the anterior deltoid, subscapularis, biceps, serratus anterior, and pectoralis major bring the arm to the ball. For the follow-through phase and coming from the ground up, the subtalar joint goes from a neutral position into an inverted position. The talocrural joint goes from a neutral position into plantar flexion. The tibiofemoral joint becomes extended. The acetabulofemoral joint remains in extension and further internally rotates. The lumbar spine goes into right rotation, right lateral flexion, and slight extension, with the thoracic spine following the same action. The scapulothoracic joint remains in retraction, and glenohumeral joint further externally rotates and abducts. The humeral ulnar joint goes from an extended position to a flex position. The radiocarpal joint goes into an extended position, and the radio-ulnar joint supinates from a neutral position. During the follow-through, the dominant arm decelerates through eccentric contractions of the subscapularis, pectoralis major, and wrist flexors. The non-dominant arm decelerates through eccentric contractions of the infraspinatus, teres minor, posterior deltoid, rhomboids, serratus anterior, trapezius, triceps, and wrist extensors. Here is a summary of the three phases along with the joint positions from the upper body, the lower body, and also the muscular contractions throughout the body through each phase of movement. As seen so far, there is a massive importance of trunk rotation during the two-handed backhand, which, as previously mentioned, heavily involves oblique slings, including anterior and posterior sides. These muscle actions result in a maximal racket rotation during a double backhand of roughly 130 degrees, and the shoulder position at the point of Ball contact is roughly 35 to 45 degree angle from shoulder to the sagittal midline of the body, which ultimately results in a maximal power output through kinetic linking. With that, average joint velocities increase from a proximal to distal joint position from the preparation phase through ball contact with efficient kinetic linking, and the mean translational velocity of the racket handle at time of contact with the ball can reach 2.09 meters per second. Acceleration begins during the preparation phase and ends at the initiation of the contact phase, which is Newton's second and third laws, and is highest immediately beginning contact with the ball. Linear velocity is highest at the point of contact with the ball, which is Newton's second law, while angular velocity increases up to the point of contact, then decreases with deceleration of trunk rotation, internal glenohumeral joint rotation, and internal hip rotation of the lead leg, again Newton's third law. Between the preparation and contact phases, gravity will assist with increasing angular velocity, whereas in the follow-through phase, gravity will assist with deceleration of the movement. A translational motion of the hands holding the racket occurs in the frontal plane, and high rigidity throughout the movement allows for more efficient kinetic linking and energy transfer through each phase of movement with a smooth line of motion of the racket as shown in the green line of the picture. Three common performance errors that negatively affect Newton's laws and PVA include a lack of linear velocity as a result of poor racket translation, lack of acceleration in the preparation to contact phase, and deceleration beginning prematurely. Common energy leaks from inefficient kinetic linking, specifically increased wrist flexion prior to ball contact, lack of lumbopelvic rotation throughout the movement, poor rigidity and excessive movement in the shoulders, lack of rotation of the spine throughout the movement, and excessive lateral rotational flexion and extension of the knees can result in reduced performance and also increased risk of injury. As such, here are some tips to optimize kinetic linking throughout the chain to maximize performance and reduce one's risk of injury while performing the two-handed backhand.